Hidden in the front of your neck lies a small butterfly-shaped gland, the thyroid. Though only a few centimeters wide, it acts like the body's thermostat. It makes two hormones, T3 and T4. These are chemical messengers that enter every cell. They control how fast we burn energy, grow, and think. Imagine a city where the thyroid is the power grid. When the grid works, lights shine, trains run, and factories produce. But if the power falls, the city dims. In the body, this dimming is hypothyroidism. When thyroid hormone drops, the effects spread across the body. The mind slows. Forgetfulness, difficulty concentrating, and even depression appear. The body feels heavier. Fatigue, unexplained weight gain, and slow reflexes become common. Muscles ache. Joints feel stiff. Movements seem sluggish. The skin and hair change. Dry, rough skin. Hair thinning, sometimes even the outer third of the eyebrows fading. Nails become brittle. The face can swell, especially around the eyes. The voice may deepen and become hoarse. Speech may slow. The gut becomes sluggish, leading to constipation. The heart beats slower, sometimes causing dizziness. Hands and feet stay cold, even in warm weather. In women, periods may become heavier or irregular. In severe cases, fertility is affected. Every system feels the slowdown. It is like living underwater. Every action takes more effort. Every thought moves through fog. But why would the thyroid fail? The most common cause is autoimmunity. In Hashimoto's thyroiditis, the immune system mistakes thyroid tissue for an invader. White blood cells attack it. Slowly, the gland is destroyed. Other causes exist too. Surgery to remove the thyroid, radiation treatment for cancer, severe iodine deficiency, still common in parts of the world, or even medications like lithium. Whatever the cause, the result is the same. Too little hormone, too much slowdown. Because the symptoms are so wide-ranging, hypothyroidism can hide in plain sight. Doctors rely on blood tests to unmask it. The main test is TSH, thyroid-stimulating hormone. It comes from the pituitary gland in the brain. When thyroid hormone is low, the pituitary shouts louder, raising TSH. A high TSH is usually the first clue. Next is free T4, the actual hormone level in the blood. Low T4 with high TSH confirms hypothyroidism. Other tests may help. Antithyroid antibodies can reveal autoimmunity. Ultrasound can show an inflamed or shrunken gland. These investigations reveal whether the thyroid has simply slowed or stopped altogether. Fortunately, treatment is simple and effective. The missing hormone is replaced with a pill, levothyroxine. It is a synthetic form of T4, identical to the body's own. Once swallowed, the body converts it to T3 as needed. The dose is carefully adjusted with blood tests every few months. Too much replacement and the body overheats. Anxiety, weight loss, heart racing, too little, and symptoms return. Balance is everything. With the right dose, most people regain full health. The power grid hums again. Treatment is lifelong but simple. One pill every morning. Yet it requires patience. Symptoms may take weeks or months to fade. Doses may need adjusting with age, pregnancy, or illness. Lifestyle also matters. Adequate iodine in the diet supports thyroid health. Some foods and supplements like excess soy, calcium, or iron can interfere with medication. So timing and awareness are key. Still, most people live completely normal lives with the condition. It is astonishing that one tiny gland controls so much. A few molecules weighing milligrams guide growth, memory, and energy. Without them, an infant cannot develop a brain. An adult cannot sustain energy. A society without iodine salt can suffer an epidemic of fatigue and stunted growth. The thyroid reminds us that even small parts can steer the whole. That biology is built not just on organs, but on signals.